Okay, so we're just going to start off actually lying down today. So when you lie down, if you'll probably feel like you need to lie on your side. Most pregnant women get to that stage, by the 20 weeks or so, or more, or even earlier sometimes. If you're watching this and you are sort of still early days and you're okay still on your back, then that's absolutely fine. But make sure you've got cushioning under your knees if you're on your back, and maybe even cushioning underneath the bottom just to raise you up a bit. Otherwise, if you come to lie on your left side and make yourself as comfy as you possibly can, so lots of cushions under your head, lots of cushions in between the knees, underneath your bump if you need it. And if these bolsters are excellent, we have these in the studio, but they're really good for just raising up the knee. If you happen to have one at home, that would be wonderful. And I'll let you get settled. So today we're going to do a few practices to help with stressful days, or days when you've got a lot on, whether that's physically moving around quite a lot, or you've got a lot of work mentally to do, or if you're quite overloaded emotionally and you've got, you might have lots of people relying on you, and lots of family that you're looking after and caring for. So can get quite overwhelming in pregnancy with all these different sides of our life, and the hormones within our bodies can sometimes make it feel quite overwhelming for us. So we'll focus a little bit on that. And that's mainly through being able to slow down the breath and to focus your mind on the breath itself and the movement with the breath. So you could close your eyes as you lie there, maybe have a hand resting on your baby, wherever feels comfy for you. And if that's not comfortable, then just relax however you want to be. I'm going to take a few really deep sighs. So take a breath in through the nose, and as you exhale, let that out breath flow through the mouth. You can be quite loud if you want to be, and it's really good to voice any emotion. So take a big breath in, be really loud if you want. And the last one, taking a big deep breath in through the nose, sighing away your out breath. Letting go. So letting go of your day and letting go of the physical weight of your body down into the ground beneath you. Letting go of anything that's on your mind, and letting go of any emotions that are really on top of you. And easier said than done sometimes. So we'll start to focus on the breath and just let your breath come and go, being aware of your in breath and your out breath. And whilst you're aware of your breath, being aware of that in breath and out breath, simply following the breath like a journey, you might become a little bit more aware of your baby and just start to become aware of any movements that your baby's making that you can feel inside you, whether they're flutters or larger kicks. We'll expand that awareness of baby's physicality within to other feelings of your body that you can sense. So perhaps the ground beneath you, perhaps the touch of air against your skin, perhaps the texture or the texture of clothing or blankets. So being fully aware of your feeling skin. And then from that awareness of your feeling skin, we'll just shift your awareness into your ears and just pay full attention to your sense of hearing. And without actually having a conversation or even putting names to sounds, I just want you to listen. These noises and sounds are the sounds of this moment, bringing your focus to the present moment. Can you pick out a sound really, really far away? And then draw closer to a sound perhaps in the house or flat that you're in. And then drawing closer to maybe there's a sound in the room that you're in, if any at all. There might not be anything. And then drawing even closer to that gentle, intimate sound of your own body. Perhaps you can take your awareness to the sound of your own breath. Being aware of each in-breath and each out-breath. And now as you take a breath in, let's just shift the awareness to your sense of smell. And when you next breathe in, just notice whether you can pick up any odours or aromas near you or sort of in the background. And it may be that you don't really smell anything. Just notice that. Now shifting to that closely related sense, your sense of taste. So just activate your taste buds, noticing any taste in your mouth, perhaps bitter or astringent, sweet, sour. Or perhaps you don't really pick much up at all, and that's absolutely fine. And now, coming back to where we started, to your sense of touch and just feeling that presence of your baby within, baby's movements, and taking a moment to really check in with your baby, making that connection of love and warmth. And at the same time, just acknowledging how you're feeling right now, knowing that however it is absolutely fine. We accept it with kindness and compassion. And then when you're ready, just expand that awareness to include your whole body and notice how your body's feeling today, whether you might have any aches or pains, or whether anywhere is a little bit tender, and just remembering to be kind to yourself as you practice your yoga today. We're going to breathe in a bit more deeply now. And as you breathe in, just draw in lots of energy and light into your body. So we energize and we send that energy all around your body. So sometimes connecting to the senses can be really lovely to bring you into the present moment. It's a nice sort of mindful meditation that brings you right to this moment. So you can really bring your focus and ground yourself. So maybe you'll want a little yawn, a little stretch. Feels good for you. And once you've brought your bit of movement in, we're going to bring ourselves up to sitting. So you can push yourself up using your arms. And I'm going to suggest that we kneel up to start with. So you can move really slowly. It's only a suggestion, so if you're not comfy to kneel up, then just sit cross-legged. These bolsters are great for kneeling on, but you can do the same with a couple of cushions underneath you, and it's just to raise you up and to take pressure off the legs, especially if you get prone to swollen legs and things like that. So we just raised up. I'll feel a bit close to camera now. Right, and then we're just going to have left hand on your heart and right hand where baby is, or somewhere appropriate on your belly. And we'll just become aware of that steady breath again, breathing in, breathing out, sitting tall. And sometimes sitting up to focus on the breath is a little bit better, so you don't fall asleep, basically. So it's quite, lots of people fall asleep straight away when they do their breathwork lying down. So we're just going to imagine as you breathe in that you're breathing into the heart area, and you'll feel the warmth of your left hand over your heart. And when you breathe out, just imagine and feel that you're breathing down to your right hand, down to baby. So on the in-breath, breathing into the left hand at the heart, exhaling down to your right hand. And there is an energetic connection between the heart and the womb space. So these are called nadis, energy lines, energy channels in yoga. In Chinese medicine, it's the meridians. So we're just focusing on that energetic link between the heart and the womb, or where baby is. And so you can form this sort of circle of this link between the womb and your heart. And you can do that with your awareness, with the breath, both. You can even do it with feelings and emotions. So as you breathe in, just draw in that heart energy, the warmth and love. And as you breathe out, you're sending it down to your baby, down to the womb, and back up. As you breathe in, you're accepting, drawing that energy in. So we're going to just come into a mudra. As you breathe in, we're going to gently bring both hands together at your heart. When you exhale, we're going to form Yoni mudra, which is the index finger and the thumbs together, and we're just gently bringing them down to the lower abdomen. So on your in-breath, we turn the hands up, so the palms come together, back up to the heart. And exhaling, pointing the fingers down. This is Yoni Mudra, down to the womb. And again, you're just tracing that energy line. And this can be nice to connect in with baby. If you've had a really busy day and finding it difficult to focus, difficult to connect, just breathing fully and completely, and let the breath move the hands. So it's very slow, very subtle. Okay, and we'll just do that one last time, finishing as we bring the hands back to the heart. Okay, and then when you're ready, you can just relax the hands down. I want to just shake them out a bit, shake out the shoulders. And then just reach forwards, reach upwards, stretch your arms up above your head, stretch into the fingertips, and bring those arms back down behind you. So we're circling them really slowly. Everything's always slow with pregnancy yoga. Inhaling up, exhaling, the arms down. As your hands go back behind you, we're just going to clasp the hands together. If your legs get stiff, sat like this, just go up onto your knees. I'm just going to gently draw the shoulder blades together. So you open up across the front of the chest and let your chin come down. And just take a breath in, lift the chin up to the ceiling. Have a sigh as you come back chin to chest. Lovely. Breathing in, chin pointing up to the ceiling. Exhaling. Chin to chest. As we bring the chin up to the ceiling again, just stay here for a moment. Open and close your mouth a few times. Okay, take a breath in, and as you exhale, chin to chest. Brilliant. You can let go of your hands. Reach the arms out in front of you again, and as you take a breath in, just go downwards, lift the arms up, reach right up, and exhale down in front of you. So circles around the other way, inhaling, reaching up to the ceiling, exhaling down. Okay, as your arms come down in front of you this time, if you just bring your right elbow on top of your left, so just watch out if your boobs have grown. We're going to bring the forearms together, and sometimes this isn't possible because boobs have grown. So you could just have the forearms together like that if that's you, but otherwise, right elbow on top of the left, wrap your hands around. We're coming into the eagle, arms of the eagle. We're going to take a breath in and lift your elbows and fingers up and away from you. And as you exhale, just let them relax down a little bit, but don't let the hands come in towards the face. This will give you a lovely stretch as you work with the breath, lifting up on the in-breath and down on the out-breath. And one more time. And as you exhale, you can release and just give those shoulders a good wriggle. And then if you do the same, just bringing your left elbow on top of right, wrapping the hands around, or again, forearms together. We keep the head central in line with the spine, inhaling to lift up and away, exhaling to relax the elbows down. Try to let go of any gripping in the belly as you do this. And there might not be much movement at all if you're quite stiff in the shoulders. And at the end of your out breath, you can release and just give those shoulders a good wriggle. Brilliant. Okay, so just going to come off my cushions, and we're going to come into a bit of a flow, a bit of a sequence, which I'll show you on the side actually. So we're going to take the knees nice and wide, And as you take a breath in, just lift the arms up above your head and separate the hands as if you're really opening up, inviting in lots of energy, looking up. As you exhale, we're going to bring the hands down. We're going to reach out in front of us. Okay, and have a stretch into the fingertips. You spread those fingers. On your in-breath, we're just going to come forwards. So you drop onto your forearms and you lift up onto your hands. And lift up the chest and the chin. So we're not emphasising a back bend here, but more opening up the heart area. So that's on your in-breath. And as you exhale, we're just going to bring the chin in and round across the shoulders and move ourselves back so your bottom comes to your heels. So on your in-breath, we slowly come forwards and we start to lift the chest and the chin. And on your out-breath, we tuck the chin in, round across the shoulders and bring your bottom back to your heels. Lovely. Do that one more time. So just emphasising the heart area rather than the lower back. Lovely. And with the knees wide, that will give you room for baby. As we come forwards now, we come to all fours. Just bring the knees in a little bit so they're underneath your hips. Okay, and we're going to think about using the muscles of your belly to hug your baby in. We try not to let the back sag down, so we keep it nice and strong in the pelvis, because we don't want our hips to twist with this. We're going to take a breath in. We're going to slide our left foot out behind you and tuck the toes under, not letting the hips wiggle. We're going to reach your right hand out, so it's a diagonal stretch as you breathe in. Looking down and exhaling back, spreading those fingers, knees under the hip. Inhaling, stretch your right leg out and your left hand. Keeping strong in the pelvis, exhaling back. We're going to do that twice more each side. If you feel strong and steady in the hips and they are not twisting, try lifting that back leg and point the toes down. So we can exhale back. Well done. Hugging in, baby. Keeping really strong in the pelvis. And when you've done all three, each side, go round across the shoulders, take the knees wide and push back into your wide knee child pose. And perhaps you're on your forearms, or if you've got lots and lots of room, you could be stretched out. Or if you've not got so much room, use whatever you've got to rest on. That's when balls come in really handy to just lean on with this wide kneed position. We're just going to focus on the breath for a moment and just being aware of your in-breath and your out-breath. And when you next take a breath in, breathe in through the nose and out through the mouth. And there's just a tiny gap in between the lips, so you're just gently blowing that out breath through the lips as you exhale. When you breathe in next time, in through the nose, squeezing up your pelvic floor. So all the muscles of the pelvis, the openings, drawing them up, a big lift. And as you exhale, blowing through the lips and slowly letting go. So inhaling, squeezing up. And exhaling, blowing through that tiny gap and just slowly letting go of your pelvic floor. Just do that a few more times, squeezing up as you inhale. Big lift, exhaling, blowing, letting go. Well done. And when you get to the end of an out breath, we'll just gently uncurl and push yourself up. So people's knowledge of their pelvic floors is always quite varied. And if you're not quite sure, basically, you've got your two sitting bones, which are the two knobbly parts underneath you, the bottom of the pelvis. Sitting bones are what we sort of call them in yoga. I think they're called ischial tuberosities or something in proper terms. And then you've got your pubic bone at the front, which we know where that is, and your tailbone at the back. And so then your pelvic floor is a sort of a hammock of muscles and layers that go between these points and around the what's the word? Orifices. The vagina, the rectum, and the bladder, the urethra. So it's all it's quite complicated, but those are the muscles. And if you're not quite sure whether you're doing it, if you have a little cough, this is a good position to do it in, a little cough with something in between your legs. Having something there just helps to feel those muscles a bit more. So you have a little cough and you can just feel everything relaxing. So if you can feel it relaxing, then those same muscles you're just drawing up. And you can sort of isolate the muscles in different ways and strengthen them up in different ways, but we're not going to really do that in this class. But that's the basics. Let's come back to all fours and spread your fingers and have your knees underneath your hips. So I will say actually that pelvic floor in yoga is called, it's sort of equivalent to Mula Bandha, which is the root lock. And in yoga, you draw up the root lock to intensify a practice and to maintain the energy in the body. And in pregnancy yoga, we want to release as well as draw up and tense. So we want those muscles to be used to relaxing, strength, be strong, be flexible. So don't always focus on the tensing up, also focus on that letting go. Okay, so let's bring your left foot up to the outside of your hands, and if your floor is quite hard, pop a cushion underneath your knee. Okay, you want your foot as far forward as it will go, and we're just going to start to circle the hips. Okay, so nice loosening up of the hips, pressing down into your foot, shifting the weight. Let's change direction. Lovely. And we'll come back to the center. Just walk your foot in a little bit so it's underneath your knee, and then we're going to lift up. So we're forearm into the standing leg. You can just let your right arm dangle and really relax it, maybe even circle it a little bit, and hopefully baby's just in that little gap. So we're going to start to take a breath in, reach forwards and reach up. And as your hand goes back behind you, follow it if you can as you exhale, coming full circle. So inhaling forwards, lifting up, exhaling. Feel the ground beneath you. So you're grounding yourself whilst you focus on the breath and the movement. Lovely. And as your arm comes around this time, just bring it in behind your back, draw the shoulder back, And this is a sort of version of a twist. You could, if your arm is feeling okay, lift the arm right up. You know you're pretty flexible, and you could bring the hand down, but as long as that doesn't squash baby in any way, this is a nice open twist. And when you've had enough, just bring the arm down, and we'll bring the hands back down to the floor and slide that left foot back. We're going to have the knees underneath our hips, so just make sure your knees are underneath your hips. Spread your fingers. Just going to have like a mini press up where you take a breath in, hug baby in with your muscles. Exhale, bend your elbows, come down. Breathing in, come up. So it's more in the arms. Press up, exhale down. And one more maybe. Lovely. And then inhale, exhale, surround your back, bottom back to your heels. And just stay for a moment in your relaxed child with the knees wide. This time, we're just going to do the pelvic floor muscles. We're going to have like 10, just really quick pulsing. So tense release, tense release, tense release. Just as quick as your muscles will let you do them. And might take a little bit to get your concentration going. I always like seeing everyone's concentration when we do this in class. So you do as many as your body will let you, then have a rest, and then do it again. Lovely. And then have another rest, and then just see if you can do some more. And don't worry if you find this really difficult. Like any other muscles, your pelvic floor will get stronger and stronger and more flexible. You know, it will get more circulation into it the more you do your exercises, and more energy there. So it's really good to keep them going and to, you know, try different exercises. You can become a bit more aware of whether you are more of a, what do you call it, hypertonic or hypotonic, where you, like, some people tense up their pelvic floors quite a lot and find it hard to relax them, and then the other way around, people have relaxed ones and then find it hard to strengthen them. So you might get an idea of which way you are and what you need to work on. When you've had enough, just gently uncurl again. We'll walk back to all fours, spread your fingers, and this time bring your right foot up to the outside of your hands, toes out at an angle a little, start to circle. And just as much or as little as is comfy. If you have any discomfort as you do this circling in your pelvis, then you can bring the knee back to the other one. Otherwise, it's really nice as like a half squat, opening up the pelvis and the muscles attached. Lovely. So let's come back to the center. I'll just walk the foot in a little bit so your heel's underneath your knee, lifting up so the weight's going into that knee. Relax that left arm. Okay, so we're just going to inhale, reach forwards, lift up, and follow the hand as it goes all the way back behind you, exhaling as you come full circle. So inhaling forwards, lifting up, back, exhaling, full circle. The ground beneath you, the connection you have with it. Spread your toes. As your arm comes full back behind you, just maybe tuck it in behind your back if that feels comfy. Draw the shoulder back. maybe looking up a little bit. You might be fine here, or you might fancy lifting the arm up. If you're quite flexible and used to practicing yoga, you could even bring the hand down to the floor. But if you can feel it, if it feels uncomfortable, then just come out a bit, retreat. You can slowly bring the hands down, and we'll slide that right foot back. Lovely. And then we're just walking the hands in. And we're going to stay on the floor for our next one, but you'll want a cushion handy. So I'm just going to sit to the right of my feet and bring my feet round so they're sort of off to the left. And I'm going to make sure I'm raised up a bit. So I'm sat on my cushion. Depending how big baby is, you might need to be a little bit higher. And if you feel wonky, you might feel like you need to be a bit higher as well. Sometimes this is a really good indication of which of your hips is a little bit tighter than the other. It's a really nice series of movements for the pelvis, for loosening up, but also helping to realign the pelvis and to ease out lower backache and middle and upper backache, actually. So it's just a really good one. So if you have any knee issues, you can straighten out that whichever leg. And from this position, we're just going to see if we can start to make a circle. And it might be quite a subtle circle, small circle. It might not feel like a circle. Start small and just gradually make your circle a bit bigger. And you can have hands on knees to help you try and relax your shoulders and let that circling spiral up through the spine. So it's like a lovely spiraling movement, and just feel your way into the spirals. Be aware of your breath and just make sure you're breathing fully and completely. We'll go around the other way when you're ready. So again, just starting small and slowly getting larger and larger and feeling for the spirals. Just noticing how it feels in your body as you move around. If you're towards the end of pregnancy, sort of in the last few weeks, then you'll be going really slowly and subtly. And I think as the head presses down or gets more engaged, then you really want to have a lot of cushioning underneath you. Come back to the center and keep your hands on your knees. We're going to do some little pelvic tilts. So as you take a breath in, we're just going to sit up tall. You might feel the sitting bones pressing down into your cushion. Lift the heart, and as you exhale, we're going to just round across the shoulders, and perhaps you'll feel a gentle tilt of the pelvis towards you. So breathing in as you lift up and you sit up tall on your sitting bones, and as you exhale, sort of rounding across the shoulders, tucking the pelvis under a little. So as you get further in your pregnancy, you'll find that pelvic tilting there becomes really subtle. So very micro movements. But this sort of rippling of the spine really helps to ease out backache. So let's just sit up and move on to the next movement, where you're just going to have your right hand out to the side. This is slightly strange. As you take a breath in, we're going to lift the left hip and we turn around to the right. And your bottom lifts up a little bit off the ground. As you exhale, just bring your bottom back down and come back to the center. So it's a left hip lifts up and we twist. And then we exhale, bottom back down, left bottom, buttock. Okay, so if that feels quite easy for you, then try squeezing your left buttock as you lift that left buttock and turn to the right. And then as you come back, just let go. That's just complicated. Don't worry about that one. Okay, and then finally, you can forget about your bottom and we're going to sweep the left fingertips across the knees as the left buttock lifts. Lift up your arm, follow it as you exhale and circle around fully and completely. So it's just a full breath as you circle, following the hand with your gaze. Lovely. And then as you come around, you can wrap that left arm around baby. Bring the right hand in behind your back. So you're pressing down into the floor, giving baby a hug. And we're just coming into a full sort of, or an open mermaid twist. So you can perhaps lift up a little bit and make the spine nice and long as you breathe in. And as you exhale, just relax into your twist. And this always reminds me of the Little Mermaid sitting on the rock in Copenhagen. At the end of an out breath, you can come back to the centre. By all means, get your legs out now if you want to, if they're a bit stiff. But if you are okay for the moment, you could try just leaning back into your hands, if that feels okay. And just maybe breathing in and feeling the openness in the tops of the lungs. A few sighs. For most people, being on your hands is fine. If you know you're a bit more flexible and you want to, you could go back onto your forearms, or you could lean into the sofa or something like that, which is also quite nice. If you don't have one there right now, then just do it later. So yeah, at the end of an out breath, you can walk your hands in, and let's just get those legs out. Okay, give them a good wiggle. Just do what you need to do to bring them back to life if they've felt a bit cut off. Okay, and then we'll take the legs wide, and so you're bringing your left foot now into the right thigh, and take your right foot around. So we're back in that same position, but the other way around. And again, just be aware of how your knees feel. Be aware of how the hips feel, because this is we're usually quite lopsided in the muscles. You know what's strong and what's more flexible. So you might need a bit more height, or you might need to go a bit lower. Whatever feels good for you, do what suits your body. And we can find our circling. This is my tight side, so I don't feel like I'm making a circle when I go around. It feels more like a square, so I have to concentrate a bit harder. Just allow the muscles to ease out. So once you've got that circling going, just try and relax the rest of your body and relax the shoulders. And perhaps if you're nearing the end of pregnancy, you'll focus a bit more on the sort of heart area and circling around the thoracic spine. Let's change the other way and just find your circle. So this series of movements, as well as being brilliant for your pelvis and your spine, it's also very grounding. Because you're also focusing your breath with the movement, it's very calming. So it's brilliant for pregnancy. And it's probably not one you do immediate postnatal period because of the positioning of your pubic bone. But definitely good for when your cycles come back. It's really good for when you're not pregnant, for the circulation in the pelvic floor and energy. So we'll come back to the center, hands on knees, and as you take a breath in, just lift up, sitting on your sitting bones, lifting the heart. Exhaling to round across the shoulders and slightly tuck the pelvis under if you've got that room. Focusing on the breath. And moving with the breath. As we get to the end of your out breath, we'll sit ourselves up, and you can support yourself with your left hand now. So we're going to be inhaling to lift the right hip and right buttock and twisting around to the left, and exhaling back again. So we'll get that initial movement. Inhaling, lift and twist to the left, exhaling back. Lovely. And then if you want to, you could try squeezing your right buttock as you lift it. And if you find that hard, please don't worry. I find this really hard because this is my weaker side. It's really hard to squeeze my bum, but it's getting better. I'm going to forget about squeezing my buttock. I'm going to just sweep the right fingers across the knees as I take a breath in, lifting up my arm. Follow the hand round in a circle as your bottom comes down. And try and relax your arms. Let the elbows be soft. And just feel into the movement, into that lovely circling. These circles and rocking movements with the breath are just so relaxing. They really deeply relax you and take you into a meditative state. Okay, so as your hand comes round this time and your bottom comes back down, and wrap that right arm around baby. And you can move that left hand more in towards the back, so you're pressing down into the floor, lifting up the spine as you breathe in. And exhaling, just drawing the left shoulder back. You might feel that right thigh rolling in. Just take a few breaths there. And when you're ready, come back to the center. And if you've got it in your legs to just go back for a moment, taking the hands back behind you, then do. If you need to straighten them out, that's fine. Take a breath in to the heart, opening up the top lobes of the lungs. Just take a few sighs there. Grounding and opening up the front of your body, creating space for baby and for your breath. By all means, go back further if you've got that flexibility. Watch out for the dog. And then we can just walk the hands in when you're ready. Maybe leaning over to get those legs out if it makes it a little bit easier. You can have a little bit of a shake out. Okay, so we're going to just come back to a sort of kneeling position. So you sweep the feet round, and we're going to come into a squat. Now, supported squats are better towards the end of pregnancy. When I say like a supported squat, I mean like using a small stool or something solid like this bolster or a couple of really firm cushions from a sofa sometimes is all right as well. And really that is just to take the weight of baby, because the weight's going down into your pelvic floor as you get towards the end of pregnancy, and it's really quite heavy down on your poor old pelvic floor. So it's good to have the support there, and that's usually, you know, once you're 34 weeks more, that's what is better. So but if you're not there yet, take your support, don't bother with it unless it's uncomfortable. And we are all different, and especially if you've had a baby before, and you might feel like everything has you know, loosened up a bit quicker. So just go with what feels comfy. And we've all got different musculature on the legs and different hips, different ankles. So don't worry too much about bringing the heels to the floor. You can, some people do like to put cushions under their heels. You can use something in front of you to hold on to if you want. And so you might, if you have no problems in the pubic bone, then, and you feel like you could have a little swivel on your feet, then try that. If you've got any pubic bone dysfunction, you know, and it's not being supported properly, then stick with your support underneath. So as you swivel, you might even like to just lift up an arm and then bring the hand down. It's nice working with the breath, and you can inhale the arm up, swivel, exhale back. If your shoulders are a bit stiff and they don't want to sort of lift all the way up to the ceiling, then you know, just whatever's comfy for you. Okay, and then we'll come back to the center. If you want to come into the traditional pose where you've got the elbows in the knees, you can bring the hands together and try and draw your tailbone down towards the floor, and just try and lengthen the spine as you press your elbows into your knees. If you find your wrists hurt, and some people do get carpal tunnel in pregnancy, it's quite nice to go the other way as well. So you bring the backs of the hands together and just have a little dangle. Or even slotting your joints, your knuckle joints in, is also a nice one. Once you've had enough though, you'll know when that time comes. Just bring your hands back to the floor. Take the feet as wide as you need to just lift the bottom up into the air. So baby's in between the legs. And then we're just going to gently uncurl with your knees bent. And come up really slowly so the blood doesn't rush. Okay, so we're just going to stand with the feet good hip distance apart for a moment. Soften the knees, and as you take a breath in, just shift the weight forwards onto the toes. Exhaling back. It's quite hard doing that without some sort of swaying arms, I find. So as you lift up your heels now, inhale, lift up the arms. Exhale, bring the hands down, and then the heels. So it's quite hard. So inhale the arms up, lift up onto toes. Exhale down, heels come down last. So just shifting the weight. And don't worry if you feel wobbly. Try and have a little spot that you can gaze at, that you can focus on. Okay, as we bring the hands down, we're going to bring the heels down. We're just going to bend the knees a little bit. Okay, and sweep the hands back. I'm going to do this on the side now. I'm going to lift the arms up, come up onto your toes. As you exhale, bring the heels down, as if you're just about to sit down in a chair. You can just sweep the arms back. If you're nearing the end of pregnancy, you're just going to do a shallow squat like that. But if you're before that, see if you can go a little bit deeper into a chair. So sit right back and then sweep the arms up onto toes. Exhale, sit back in your chair. Bottom goes back, really lengthening the spine, hugging baby in. And just check the weight is in fronts of your toes as well as the heels. Now, by all means, stay in your chair for a moment and we can just sweep the arms forwards and back. So you're squeezing your bottom, you're drawing the tailbone down, you're hugging baby in. And I know this is quite hard. We're just going to lift the arms up, maybe come up onto toes. Maybe just bringing the arms down and then the heels. Hopefully you're feeling okay after that. If there's any discomfort as you are doing that, and especially with tingly fingers, when the arms go up, then don't do the arms. There's a lot of blood circulating around here, and if it's not getting up here, because this bit's working hard, you might feel a bit lightheaded. But have a little shake out. Lovely. And then we're just going to finish with a nice restorative pose down there. So we were very briefly up in the air. Just going to slide the hands down and bend your knees until you can reach the floor, and then walk your hands forwards. And then either bring the knees down to the floor, or if you want to, you could just lift up into a very brief down dog and have a little wiggle. If you've got any cold or pressure in the head or any headaches, then just come straight down. Okay, so yeah, we're going to finish with a really nice restorative, which is great for getting grounded when you've got a lot on. And I'm just going to change the view over to the wall. So this is a pose to do against the wall or a sofa, if you've got one, or a bed, that sort of thing. You could actually do it in bed with your feet up against the wall. I'll show you here what I'm meaning. It's called Viparita Karani, otherwise known as legs up the wall posture. You'll need a cushion or two. Cushion's going to go right in against the wall. In fact, I need to bring that in. You may even want a blanket. And can you see? Yeah, I think that'll be all right. So this is an inversion, actually. So if you don't really want to go upside, it's not really going upside down, but the blood flow is sort of going the other way. So if it doesn't suit you, then just lie down on your side and that's fine. We've got the cushion to slightly raise you up underneath the hips and to soften it a little, because we are going to be on our backs, but just for a break, just a couple of minutes. So again, if you know that you're not good on your back at all, then just come into your relaxation posture. It's quite tricky to get in when you're pregnant, so it's good to just sit sideways up against the wall if you've got the wall. If you've got a bed there, just go sideways onto your bed or your sofa. And then we're going to gently lower ourselves down onto forearms, okay? And then right down. Bring foot up and then the other. Push your heels into the wall and twizzle round. And then you can just start to shift yourself. And you want to be as close into the wall, your bottom close into the wall, or the bed or the sofa as possible. If you don't have your sofa, if you don't have the wall there, then of course you can imagine my knees would be bent probably, and they would be just resting on the sofa. So if you do have a wall, it is lovely. So get as close in as you can. And of course, if you're nearing the end of pregnancy, then you'll just want a couple of inches maybe for baby. You can take the arms up behind your head. You can close your eyes. You can cover yourself with a blanket if you wish. If you've got low blood pressure, you might find it helpful just to keep the feet moving. And the first thing to do is simply taking a few full and complete breaths. With the arms up behind the head, it can be really lovely to just open up the shoulders and the rib cage. Just great for breathing a little bit more deeply and giving baby a bit of extra room to move. So try and find your full and complete breath. And this helps to drain away any excess fluid in the legs. So it's great if you've been on your feet all day. It's great for things like varicose veins and swollen feet. It's also quite energizing, and it's encouraging the blood flow. So down the pelvis and where your baby is, and also the energy. So it's energizing as well as relaxing. Feel the ground beneath you, holding you. Feel free to come out of this at any time. If you can't relax in this position, you might like to try a few different leg positions, especially if you've got the wall there. You could bring the soles of the feet together and let gravity help bring them down, which can be really nice. Another leg position is to take the legs wide apart. So you're in a straddle. And again, the gravity really helps to open up the inner thighs and just gives the legs a really nice big stretch. And another really nice one, which is a bit more supportive, is to have the soles of the feet on the wall. So you're in a sort of a wall squat. When you take your big breaths in, just feel the breath expanding the rib cage, feel it moving into the chest. And as you breathe out, try and keep that expansion in the chest and relax the weight of your shoulders down into the ground. And when and if you're ready to come out, you might just want to push your feet into the wall and just swizzle your bottom around so that you can get out without feeling trapped, basically. And then you might just want to go onto your side. We can lie on our side for a moment. with your supports underneath the head and in between the knees. And of course, if you're perfectly fine with your legs up against the wall, then just stay there. But otherwise, we'll just take a moment on your side and with your cushions on you, and just focusing on the breath. With each out breath, just allowing the out breath to totally relax your body. Feel the ground underneath you. With each out breath, relaxing the mind. Soothing the emotions. And just allow yourself to really let go. And perhaps on your next out breath, you could let go even more. Just feeling the weight of your body being supported by the earth, Mother Earth, cradling you in her arms. You might like to imagine as your body relaxes into Mother Earth that you put down lots of tiny roots into the ground, as if you were a plant or a flower or a tree. Just letting those little roots burrow down into the soil. Just imagining that they grow downwards and keep you really secure and strong and connected. And that those roots create a firm foundation for your pregnancy, your everyday life, and for your growing baby within. So now we're just going to take 3 more full and complete breaths before we come to the end of our class. So if you're doing this and you've got lots of time, then just stay there for a little bit longer, enjoying this time with your baby. If you're doing this right now, at this moment, feel free to stay there as well. Or at the end of your 3rd breath, we can just start to bring a little bit of movement back into fingers and toes, and just slowly bring yourself back into the room with maybe a little yawn, a little stretch. And just doing whatever you need to do, being kind to yourself. You can just gently come up and when you're ready, you can just bring your hands to your heart, whether they're one on top of the other or hands together, it doesn't matter. But take a moment to thank yourself for practicing some yoga and taking this time with your baby. We'll say to each other, Om Shanti, which is just a peaceful greeting to each other. And then Om Shanti to your babies. Om Shanti.